Hello everybody, how is it going today? Today is a great day because we are actually able to be live again. So we're really excited to be here. Hello everybody. If you have any questions, complaints, anything that you want to tell me, please tell me. This is the time. Remember, this is your time. And I'm gonna be starting as always. Hola Yuri Parra Hermosa. I'm gonna start as always just talking a little bit about what's the mindset that you have to have always in your life, of course, to encourage better and to actually enhance the beauty of yourself. Is that you can actually, of course, always remember to do something good for you. For example, just one day you start doing exercising, one day you start drinking more water, one day you remember to just take a look at your kids. I don't know, just start by doing something good. It's gonna help you so much that it's going to increase and make you feel way better. Dice Love Sandrita, Sandra hermosa, ven el día que tú quieras, de lunes a viernes. I can see you most of the days, and I will be happy to speak about it. So, as a subject today, we're going to be speaking about the single thing that we speak pretty much every time. That is the gastric sleeve. So we're gonna be speaking about the gastric sleeve, and it's good to know that the gastric sleeve is a procedure that could help you. So I don't know if you ever actually waking up and tell yourself, I want to lose weight. How many of you have actually went through a process that you actually said, I have to lose weight? Just tell me. Most of you, maybe so, says, hi, I want my blood count. I want to know what my blood count it is. My surgery is too soon. Well, if we can call you, then that means you're fine. So we're gonna be actually discussing who has thought about actually losing weight. Most of us have. Even you that are skinny and beautiful, you might even thought about losing weight. So it says I just lost 40 pounds of plus, that's great. So if you actually decide to lose weight, you try already, you actually avoid 30. You remember when you were 20 years old? Everybody in the college pictures maybe we'll see ourselves in the back in the actual book here, and we see that patients actually, I mean, we as college, we always look so skinny and so slim, and then we look ourselves at the 30s and we say I gain a little bit of weight. Well, I'm gonna tell you something. That's not your fault, and I'm gonna explain you a little bit about it. Hold on one second.
Incisions are created on the abdomen. Trocars, which serve as
Okay, so we're gonna be speaking right now. We're gonna take a look at this video right now. So just listen.
In real time, like we were there, doesn't always paint the full picture. So walk us through how this works and why you do it.
Okay, so the first thing we do in this surgery is that we make very small incisions. And in this animation, they have 6, but when I do the surgery, I actually only use 3, and I use 5mm incisions, so no bigger than a grain of rice. Once we have those ports placed, we can blow up the inside of the abdomen with CO2, air basically, and that allows us to work inside the abdomen without making a big incision. Once we get inside, we have all the organs and intestines, and we focus on the stomach. And as you can see, the stomach is about the size of an American football, as I mentioned. Now, the stomach, again, only serves to hold the food before it moves forward to get digested, which mostly happens in the small intestines. And the way the stomach works is that when it's not full, you are flat, and it releases a hormone called ghrelin, and that hormone goes up to the brain and makes you feel hungry. When you eat food, it fills up, as it has in this animation, and then it presses on those cells, and the release of the ghrelin actually goes down, and you feel satiated or not full. Now, in the sleeve gastrectomy, we're going to combat obesity in 2 ways. One is also the size of the stomach is made so much smaller that we actually have much smaller volume. So you feel full with a much smaller amount of food that you eat. But more importantly, and what's really exciting about this operation, is the part of the stomach that is removed has the highest concentration of those cells that release that hormone, the hunger hormone, ghrelin. And so by removing that, the amounts of that hormone goes a lot lower, and not only do you eat a lot smaller amount of food, but you have a lot less desire for food. You're not always hungry in between meals. And more importantly, the absorption of the food is not altered as in other weight loss procedures. In this, everything that you eat, because it goes down the same path, goes up to the brain and makes you feel hungry. When you eat food, it fills up, as it has in this animation, and then it presses on those cells, and the release of the ghrelin actually goes down, and you feel satiated or not full. Now, In the sleeve gastrectomy, we're going to combat obesity in two ways. One is also the size of the stomach is made so much smaller that we actually have much smaller volumes. So you feel full with a much smaller amount of food that you eat. But more importantly, and what's really exciting about this operation is the part of the stomach that is removed has the highest concentration of those cells that release that.
So one good news about it. Hello everybody that actually log in. We're speaking about the gastric thing and the weight loss, how to gain your life back. And we just actually discussed right now with, of course, certified bariatric surgeon in the US, how can you actually drive yourself to lose weight. Of course, something that came out to myself is that obesity is not your fault. So that means obesity, since it's not your fault, is ghrelin's fault. So since you're overproducing ghrelin, you're actually creating that hunger sensation that goes into your stomach and goes into your brain, and you're starting to actually take a look and just starting to see that you're not gaining, but you're not losing, even though you're in the strongest diet of all, and maybe you start even gaining again. So it's a great procedure if you're actually thinking about losing weight. So we're gonna be showing you some little pictures right now about the losing weight. And this patient right here came to us. She's really cool. She's actually really into her weight thing. And she actually recommended all the way from San Francisco. You see that picture? She lost about 70 pounds. So how much you have to be BMI to qualify for this procedure? Over 30. So look at this skinny girl right here. She sent the pictures and I said, doll, you should lose a little bit of weight to have the VVL. And she's like, no, doctor, I'm looking for the gastric sleeve. And I understood perfectly. So I'm going to show you how beautiful this patient looks right here. She's all happy by myself. Of course, she looked pretty already. And she lost so much weight that she's feeling amazing. So a lot of people right here that you will see, there are people that actually lose the weight, actually are happy enough, and they send us a picture. So what do we think about taking pills for diet? I'm not against that. Honestly, I don't think that you need the surgery. As everybody, they say, of course, just do diet, exercising, take pills, and that's it. Yes, but that's it for how long? For how long is that good enough? Is that good enough for 1 year? Is that good enough for 3 years? Is it good enough for 5 years? Definitely the gastric sleeve is the longest term actually losing weight for long term that you can actually find on the market. There is nothing that would actually compare to the weight loss you're gonna have. It might start right there. It might just start right there and actually just changing all the way to be here. Well, that's really exciting if you're actually losing enough weight to actually see these kind of pictures. This is just amazing. So it took me 3 months to lose 40 pounds. Yes, actually, I'm gonna tell you something. The most you can lose in a month is 10 pounds, even if you try the strongest diet. So people probably that actually have 50 pounds more and actually is trying to lose weight, 50 pounds more to be able to have a plastic surgery, that would take you at least 5 months. At least 5 months. So that would, how long it would take you to actually get the gastric sleeve and then later to get your tummy tuck done. 100 pounds in 1 year, can you imagine this? Look at my beautiful Patricia. She came in with a tummy tuck. She actually was really excited because she was going to get the sleeve. And she told me, doctor, even if I have to do my surgery again, I want to do it. Well, she done it, and then you can see that big change right there. So it's a life-changing procedure completely. I love you, Sandra. So anybody that have any questions regarding having the gastric sleeve, of course, we can actually respond to any question, but we're going to tell you exactly how it's done, okay? So there we
Incisions
go.
are created on the abdomen. Trocars, which serve as passageways for the surgical instruments, are placed into the incisions. Surgical instruments are passed through the trocars to access the abdominal cavity. The surgeon examines the abdomen using a laparoscope or video camera. The average human stomach can expand to hold around 1 to 1.5 liters of food. While in the stomach, food is combined with digestive enzymes to help break down the food into a more simple form, so that it can be more easily digested and absorbed once in the small bowel. During a sleeve gastrectomy, a thin vertical sleeve is created by using a stapling device. This sleeve will typically hold between 50 to 150 milliliters, or is about the size of a banana. The excised portion of the stomach is removed. The newly created gastric sleeve is able to hold approximately 1/10 of what the stomach was able to hold before. This smaller stomach sleeve restricts the amount of food you can eat before feeling full. The bile and pancreatic fluids from the liver and pancreas mix with the food and allow it to be completely digested and absorbed in the bowel. There is no rerouting of the small bowel or post-operative adjustments necessary for the sleeve gastrectomy. Stapling device. This sleeve will typically hold between 50 to 150 milliliters, or is about the size of a banana. The excised portion of the stomach is removed. The newly created gastric sleeve is able to hold approximately 1/10 of what the stomach was able to hold before. This smaller stomach sleeve restricts the amount of food you can eat before feeling full. The bile and pancreatic fluids from the liver and pancreas mix with the food and allow it to be completely digested and absorbed in the bowel. There is no rerouting of the small bowel or post-operative adjustments necessary for the sleeve gastrectomy.
So as you heard, guys and girls, this is a procedure that, of course, honestly is a great procedure to lose weight, but of course we minimize it. So for people that don't have to lose that much weight, so take a look at this picture. So just help me to analyze it. Of course, if you take a look at this girl, you will see that she's completely out of her mind to actually get the gastric sleeve. Wouldn't you think so? Would you think that she's out of her mind to do her gastric sleeve right there in the before picture? Well, definitely she's not. She's looking to lose 80 to 90% of the excess weight to actually be able to look like that. So having your perfect weight means that you're going to be looking like that, and you're going to fit into a size 2 or 3 or even 5. And you're going to be able to keep it simple as just keeping your normal diet. Keeping your normal diet means that that's a restrictor method, as we were speaking about it, and that does not cause any vitamins to do not absorb. So if you want to have kids later, it's not a problem. I have pictures of people actually getting pregnant after getting the gastric sleeve, feeling awesome. What happened with all the weight you lost? Definitely is not for you. For example, Sandra, I love you, but the thing is that it's for people that actually have the necessity of having the procedure done. Of course, with obesity stage 1 at least. But just take a look at that. So is the liquid very dangerous? Yes. So what we're gonna do, we're gonna have the patient with a 3 incisions right there in her stomach with a drainage connected right there. So what we're gonna be doing, we're going to actually give her a leak test right there so we can actually see it go through. And as soon as we know that everything is fine with the liquid test, we're going to give her a blue drink so we can actually see anything blue actually coming out of the drain. That would be, of course, obviously a complication, which of course everything is fixable as long as you're a certified surgeon that knows how to treat these kind of things. But we're gonna tell you the 3 complications on the gastric sleeve. The first one is that you might not be able to eat, of course, if you get a complication where you cut and you got way too small. But we're going to prevent that, of course. With the mini gastric sleeve, there is no possibility. And of course, with people getting her stomach inflamed, of course, that's probably something that could cause. Of course, the second complication of all is actually getting a leakage, which is the one that is everybody talking about, which is the most dangerous one. But it's the one that has the less of the least possibilities. The actual increase of the risk is that you already had a previous gastric sleeve procedure. For example, people that have a gastric sleeve and they want to do a bypass, or people that have a gastric sleeve and they want to get it revised and they want to get a bypass. There is people like that just in plastic surgery that they keep doing weight loss procedures, over weight loss procedures, but what they need is a surgery right here because they don't know how to actually take care of themselves. Even I saw people actually getting a gansito. You know which one it is, like the Twinkies. Put it in the blender, put it with milk, and drink it like that. Of course, that's not gonna make you lose weight. But for anybody that is excited about having a procedure like this is a really small time procedure. You're gonna be walk the first day of your procedure. So the first day you're gonna be walking. The second day, you're going to be actually drinking a little bit, and then you're going to be able to go back to work in 10 days. As simple as it is, everybody, thank you so much. We love you, we love you, we love you. And thank you so much for watching. This was the vlog of the day. I'm going to keep on vlogging because I'm going to have to stay at home. So I'm going to have to stay at home, sorry. But I'm going to be actually here just posting and posting and posting. I won't be on the office for a couple of weeks, I guess. I don't know. But I'm going to be posting a lot, okay, everybody? Well, thank you so much. So we'll see you guys soon. We love you. And we'll see you. Stay safe. Stay at home. Remember always to keep yourself with good thoughts. Go to church. I'll see you guys soon.